Ecstasy, aka beans, brownies, cowies, crystal, diesel, dolphins, EMD, MDMA, Mandy, Mitsubishis, Molly, pills, Pink Superman, Rolex, Superman, Ecstasy. Tests over the summer of 2018 show that the purity of ecstasy is at its highest for 10 years. In one batch, the amount of MDMA was 2.5 times the standard dose. This has led to an increase in ecstasy-related deaths. In the UK, it is classed as a Class A drug, which means it's illegal to have for yourself, give away or sell. Possession of the drug can get you up to 7 years in prison, an unlimited fine or both. Supplying someone else, even your friends, can get you life in prison, an unlimited fine or both. What does it look like? Ecstasy comes in pill or powder form. When it's a powder, it's called by its chemical name, MDMA, but it's the same drug as ecstasy. Ecstasy pills can be white, colored, round, square or pressed into any shape. Some pills have designs stamped into them, like well-known company logos that the pills are then named after. Ecstasy powder looks like white/grey crystals and is called MDMA, Mandy or MD. What does ecstasy taste and smell like? Ecstasy pills are usually swallowed, and MDMA is usually rubbed or dabbed onto the user's gums. They both taste bitter and unpleasant. Many of these ingredients used in ecstasy can cause bad side effects, including vomiting, convulsions, dehydration, agitation, respiratory problems, dizziness, confusion, high blood pressure, hallucinations, excessive sweating, coma, and death. If you take a drug in combination with other drugs or alcohol, then the chances of illness or death increase. How you might feel. Users feel loved up, alert, energized, anxious, panicky, paranoid. Ecstasy can also make people feel more in tune with their surroundings and have a high intense reaction to music, which is why people sometimes take it in nightclubs and at parties. What are the effects on your body? Users may get a tingly feeling, feel confused, have a faster heart rate and higher body temperature. How does it make people behave? Lots of people feel very chatty and uninhibited on ecstasy, which makes them open up and talk about things they might not do normally. Physical side effects can include dilated pupils, tingling sensations, tightening or moving of the jaw muscles or gurning, raised body temperature, a faster heartbeat and nausea. How long the effects last and the drug stays in your system depends on how much you've taken, your size and what other drugs you may have also taken. When taken orally, ecstasy normally takes 30 minutes to kick in, but it could take as little as 20 minutes, or it may take over an hour or more. Users tend to feel high for 2 to 4 hours. You might still experience some physical effects, like a fast heartbeat or insomnia for some time after. After effects. Some people find that ecstasy makes them feel down and low in mood the next day, known as a come down. This can last for several days. Common risks. Ecstasy affects the body's temperature control. Dancing for long periods in a hot atmosphere, like a club, increases the chances of overheating and dehydration. Users should take regular breaks from the dance floor to cool down and watch out for any mates who are on it, as they might not realize they're in danger of overheating or getting dehydrated. Drinking too much, and that includes water, can also be dangerous. This is because ecstasy can cause the body to release a hormone which stops it making urine. If you drink too quickly, you might affect your body's salt balance, which can be as deadly as not drinking enough water. Mental health risks. Evidence suggests that long-term users can suffer from memory problems and may develop depression and anxiety. What is ecstasy cut with? There's no way of knowing what's inside your ecstasy pill or MDMA powder until you've taken it. Even testing kits may not find everything. You may be at risk from other drugs and ingredients added to the pill or powder, as well as to the ecstasy itself. Ecstasy pills are sometimes cut with amphetamines, like speed, caffeine, and other substances that have some similar effects but are cheaper to produce.